I will shortly introduce my guest, Maria Papadakaki, our advisory board member from Crete, Greece. Very active on all kind of issues, be it equity, be it interprofessional primary care, be it bringing in social carers, physiotherapists. So I'm very happy to give you the floor to share with us the experiences with special programs for mental health for students in your students in your university and in your schools. And I leave it up to you also to introduce Christian, because you have been in contact, both of you, and shared your visions on this topic. So I leave it up to you. In the slide, you see the announcement of our next session. I really would like to recommend you on the 13th of November on mental health. So having said that, I open the next slide for you, and you tell me when I have to continue for the next one. Maria, okay? Floor is yours.
Thank you very much, Diederik. I'm very happy to be here. You are right. I do a lot of things as a social care provider, first of all, but also as an assistant professor in social work in Greece at the Hellenic Mediterranean University. This time, I will share the experience from our primary care unit from Greece, from our university, which has some innovation to show even at European level. So I assume that those people who attend may find some interesting things to see. So I have to thank my colleague Alexandra Spiridaki for assisting me in this preparation of the slides, because she's a key person in delivering special education in our university, and she may be with us, but I'm not sure. Anyway, I have to start by saying that, going to the next slide, starting with disabilities, because this is all about disability management in higher education institutes. Of course, disabilities have been a topic that attracted the attention of educational policies in the last decades, but still there are a lot of missing issues in the educational policy agendas, and we have to underline this, because as you see in these slides, disabilities among higher education students are many, and a large proportion of students seem to have a kind of disability which is not very well accommodated by the educational system. Some recent data from US in large numbers of students show that almost 1 in 5 students have some type of disability, and you can see that there are primarily mental disorders, learning difficulties, chronic diseases. And of course, this huge number, because to my eyes it looks huge. I don't see now my presentation.
Okay, okay, sorry.
Anyway.
Then I should go back to
it is it is highly underestimated, of course, because I still don't see it, but anyway, you can manage it. It is underestimated because, you know, students either are underdiagnosed, because not everywhere and not many countries have a mechanism, now it's okay, have a mechanism in place to screen students and see and identify their disabilities, especially the hidden ones. And of course, in many cases, especially due to cultural limitations and problems, we see students having certified disabilities and choosing not to disclose it because of fear of stigmatization. Besides that, we see that disabilities place a huge burden for students, because they are found in literature mostly to be less likely to enroll in higher education because of those barriers in entering higher education. And of course, when entering higher education, they are most likely to experience study delays, low performance, of course, and study delays, and high risk of dropping out their studies. And several other challenges have been noted in literature. Most importantly, discrimination from peers, lacking an empathetic approach from faculty members, and inadequate accommodations in universities. And of course, literature has a lot to say about faculty members' inability and feeling incompetent to address all these needs. And of course, faculty members have been severely criticized in literature for not offering accommodation and not meeting students' special needs. We can go to the next slide, and I would say here that what literature suggests is an inclusive learning environment, and this is what we see as an imperative. This is what we all try. Some countries are more advanced in this, some are less advanced, and by saying culture, inclusive culture, we mean positive attitudes towards students with disabilities. By saying inclusive practice, we foresee reasonable accommodations to adjust the educational circumstances to students' needs. And of course, by inclusive policy, we expect institutional decisions that support the inclusive educational model in various ways. And of course, there are several models in literature of inclusive education. You know most of them, and some very common are universal design for assessment, universal design for instruction and for learning. And all these frameworks share common themes in them. Most of them try to introduce learning goals, so try to offer certain accommodations for students. For example, in presentations, in the teaching styles, and all other accommodations necessary for students to be able to meet the academic requirements and demands. And of course, there is a need, and this is very evident in literature, a need to offer support and coaching for students with disabilities and learning disabilities and difficulties, to be able to meet all these requirements. You can proceed to the next one. However, what we see is that universities, although there are many developments in the last few decades, still are not proactive in ensuring reasonable adjustments for students with disabilities. We see that they still see learning, they see the disability as an individualized problem, and do not see disability through a whole system approach, through the person in the environment. And this is a problem because by seeing the student with his disability or her disability alone, this is not helpful, because a lot of aspects of in the studies and in the university are still missing from a European university, even in the more advanced ones. We see significant gaps in understanding disability and a lot of misperceptions, especially evident among the faculty members, which are not well trained to meet all these students' difficulties. We can go to the next slide and get into the Greek situation. And we see that there are not many research initiatives to see what happens in Greece. Of course, there are services measuring and having a good picture of how many people with disabilities study in Greek universities, but still we don't know their individual needs, and we haven't studied exactly what these needs bring for the educational policy agendas, and how these needs could be addressed in a better way. A large survey in 18 higher education institutes show that a large number of students suffer chronic diseases, and they seem to face many difficulties in completing their studies, in graduating, and we see that many of them end up in dropping out at some point. And of course, students that are stagnant, and we say, are double than those among those with disabilities as those without disabilities. So we see that in the Greek system, higher education system, students with disabilities shoulder a big burden, I would say, and they are very much discouraged in completing their studies. We can go to the next slide, and we can see that the Greek legislation has a lot to show, and there are many laws since 1983 that it was first allowed, individuals with certain disabilities were first allowed to be admitted to higher education departments, except for certain disabilities that were not eligible, we would say, because they were indicated as difficult for some sciences to attend. After that, we see many laws adding new categories of disabilities into those that would be eligible in enrolling in excess in the higher education system in Greece. And at this moment, we have a 5% enrolling in excess, those people with disabilities enrolling at a rate of 5% among the total admissions per academic year. And we also have certain legislation for people, for students with dyslexia, to be able to be examined with different forms of examinations orally. And of course, we have very early, we had in 2007, publishers were obliged to provide files in an electronic form for those who have difficulties in having accessibility in the educational material. Only now, you will see on this slide that with law 2021, people with disabilities, with special educational needs can make use of their certification, which was obtained early in primary or secondary education. Only now it may be used in university to have certain modifications needed or oral examination. And this is, as you may see, a very late development for Greece, because there was a huge gap from secondary to tertiary higher education, so that students with special educational needs could not use their certification, and of course there was not their special educational needs were not accommodated in higher education. And of course, just now, 2022, this year, we have a new law that necessitates university to operate several other units. First of all, a psychological and counseling support center, a unit for equal access for people with disabilities, a center for support in teaching and learning, and of course, gender equality and discrimination committee, for which I am also the president for my university. So, as you see, we only now try to address all these issues, somehow very late, I feel, but if we go to the next slide, we will see how we try to do that. There is a program, a project that is offered to all universities, through which there is a special fund offered, and this was the support, the funds that supported the development across all universities in Greece to build and to develop counseling centers for students and centers for the overall support of students to their adjustment in the university setting. Through these funds, we managed to develop a primary care unit that has a medical practice, has a counseling center, and has a center for educational support. And this is something that it is very innovative. The Center for Educational Support is a very innovative structure, not only for Greece, that missed this opportunity for many years, but also for many other universities across Europe, I would say, that they lack such a structure to offer so well-organized educational support for students with special educational needs. In our primary care setting in the university, we have currently 2 medical doctors, 1 nurse, 3 psychologists, 2 social workers, a special educational teacher for literature, and a special education teacher for maths. And of course, we also have people offering parallel classes for students that enter higher education in order for them to balance and to try to meet the new needs and new demands of the academic demands of the higher education institute. And this is something innovative in many aspects because we see that this initiative tries to bridge the gap between secondary and tertiary education for all students, because there is a huge gap due to missing this integration of secondary and tertiary education. And also there is a huge gap also for students that already have a special educational need and have many difficulties in attending those higher demand academic environment. So we can go to the next slide and we can see that this project for us was something special. We tried to make an innovation across Greece, first of all, and we introduce, besides we introduced an observatory for vulnerable students. We wanted to be able to monitor our students and their needs, and we developed a mechanism of epidemiological surveillance for students' needs. All students, upon their consent, written consent, and of course our students are able to change this decision anytime through their student account. They give us the opportunity to collect information on various issues: social circumstances, health and mental health circumstances, morbidity, comorbidity, learning difficulties, accessibility and service utilization in the university, and link this information, personal information, with academic performance indicators and see how good they progress with their studies in our university. Because we want to be able to follow our students, know their needs, and see if our students have certain needs that are not met accordingly, and these needs may delay their graduation from our university. And of course, they affect their well-being, generally their academic and personal well-being. So this observatory is a unique, I would say, in Greece, and from what I see, it may be a unique in Europe as well. But of course, I have to be, I am hesitant to say that because I don't know exactly all the situations across Europe at the moment, only from what I can find in literature. So this information, you can imagine, if I have all this information for our students upon their consent, you can imagine that this information offers important evidence to university authorities in order for them to plan and make any necessary policy reforms to accommodate those needs of students and be able to support their graduation and their smooth educational process, I would say, and studies and progress in our university. We can go to the next slide, and we can see that there is a full mechanism for newcomers. We try to accommodate our students all throughout their studies, but also from the beginning. We get new students and we offer them opportunities to integrate smoothly to the educational system with peer support, with educational support, with coaching, but also integration is managed with with different ways, with offering time to other students, with getting time from other students, sharing time in a useful way, which this facilitates a lot integration of students in our university. So we can go to the next slide. I don't need to delay in this. And of course, the most important thing is the Center for Educational Support, which I will spend some more time in our next slides. It is our innovation. Another innovation, I would say, is of course, this is something that exists in many universities across Europe. There is a person which was recently assigned as a counselor for students through our legislation, and this person is belongs to the teaching staff, and of course has the obligation to support students with special needs and special learning needs by mediating between the students, the staff, the administrative staff, and of course by reinforcing and empowering students with to go through their academic studies. And besides this, in our next slide, you see that what our educational, our Center for Educational Support offers, and why it is innovative is because we have staff full-time every day. For 8 hours a day, they offer support to our students, and they try to detect learning difficulties, difficulties in attention, in concentration, in academic skills, in mathematical skills, in organization of time and study. So in many aspects and skills which are necessary for students to progress with their academic studies. And at this moment, I have to share with you that we have many students that come unattended and have not a diagnosis at an earlier stage during primary or secondary education. And this is somehow problematic because those students have have shouldered a lot of barriers throughout the earlier studies in primary and secondary education, and they have managed with many difficulties to reach higher education without a diagnosis and with many barriers throughout their studies and their academic life. So in this case, since in the Greek system we don't have a routine screening for students at an early stage, even from kindergarten, so many people reach higher education institutes with learning difficulties and with undetected learning difficulties. And this is what we try to do on a daily basis. We try to deliver and administer certain tests to our students to detect their difficulties and refer them for a formal diagnosis to adult public services at the community, and help them to get their certification, and of course throughout their studies to help them follow and progress well without these difficulties placing any further burden to them anymore. Besides that, we help them design personalized educational plan to co-develop a plan, but also have learning material appropriate for their disability or their learning difficulty. and of course mediating with other students, teaching staff, and coordinating group counseling in these cases. We can go to the next slide. All people, all students that have a certification, of course, can make use of these services, the Center of Educational Support. And of course, all other people who have not the certification can get the initial initial test to see whether they can be referred for a certification, as I said just before. What I have to say here is that still we have other missing issues in our setting, that we have very few public centers that can offer this adult assessment and offer certification for adults. So this is a problem for us, because when we see that we have a person that suffers learning difficulty, it is difficult to refer them to close by to public services for an adult certification, and this adds more burden for these people. Of course, we try to find ways and channels for communication, and of course with other services, and of course we try to raise this issue, to raise visibility also at the ministry, Greek ministry, about the need for more centers that could offer adult certification for learning disabilities and learning difficulties, which still are missing from the Greek system. And of course, the same thing is missing also from our tests. There are not many tests validated to offer this initial detection of cases of adult learning difficulties. And we are still, and there are many initiatives in the academic sector in trying to validate tests for adult assessment. We can go to the next slide. And this is somehow the care pathway, the pathway that we follow in our Center for Educational Support. You can see that there is a picturing of difficulties. What is the difficulty that the student is confronted with? We have self-reported tests, and we have also some tests about reading skills, assessing reading skills, writing skills, and spelling skills. And of course, we assess difficulties in decoding, reading accuracy, reading comprehension, spelling, writing, according to the academic style. And based on what we detect as being the major difficulties for the students, we try to intervene with one-to-one sessions and make some tailored interventions for strengthening the fields of difficulty for those people. And at the same time, we offer other accommodations like video, like parallel lessons, afternoon lessons in mathematics or literature, where people have the most evident difficulties during their studies. Going to the next slide, I'm almost finishing. We see that at the same time we see students holistically. We see that there is a social worker, there is a psychologist, there is a medical doctor, of course, and the nurse that we said at the beginning, because we try to see the student with all the difficulties that they face and they're confronted with. And we see that, for example, the social worker collaborates with the special needs teacher, and they try together to accommodate all the other social circumstances that are behind the special needs. And of course, they try to make the appropriate referrals to the community in order for the students that with the special educational needs to be able to be supported by other services in the community when this is necessary. And of course, we have seen that this is very important and very helpful for our students, because due to the financial crisis of the last decade and all the crises that have followed after the financial crisis, we see that students are very vulnerable. They come from very vulnerable backgrounds and very difficult social circumstances are in place, family circumstances, relationship circumstances that make their academic life very difficult. So with all this mechanism of educational support, social support, medical support, and peer support, because this is even the most important, we try to be there for our students and accommodate their needs. And going to the last slide, Diederik, I would say that we offer for every month we have several sessions for people. We accommodate many students, and of course I have to say that even now we try to make these services visible to our students, because not all students are familiar with the services. Not all students still feel comfortable in using the services, and there is still a lot of stigma in our country in going and seeking help. And this is still a problem that we have to overcome in our setting. Although we have the mechanism, some people still choose not to use it. And even our staff is not well trained to accommodate and to use also these services, and we still have a long way to go, but we are very happy to be able to have this opportunity to offer these services to our students. This is from me. I will be able to respond to any question that may arise from the audience.
Yes, there are some in the chat, but I can read them for you. So the first question is, do you have some insight about students who are also family caregiver? So the combination between being responsible for what's going on at home and being student.
We have this information in some cases for those students that choose to share it with the social workers, but this is not official at the moment. We cannot share a certain number at this moment, but we are collecting this information, of course, not regularly and based on the consent of the students when they wish to share this information. And what we know for this is, of course, that those people who have a family burden and are carers as well, or have other circumstances at their families of origin, have more difficulties, and we see a lower academic performance. And this has already attracted our attention in our universities, because we see that we shouldn't see our students separately from their parents or their family of origin, because they are still very much linked with them and very much emotionally, socially, financially dependent on them. So they are still not separated from their family of origins, although we need to see them in both sides and both ways.
Okay, thanks. Next question about the nurses who are involved in providing assistance. Have they a special education?
Not in our case, no, they don't have a special education. We try to offer them additional education when necessary, and of course, based. This is very helpful now, and thank you also for this question, because based on the evidence that we collect from the observatory for vulnerable students, we can also see what the students' needs are in our university, and we try to offer additional education for our staff according to the special needs of our students. And for example, we see that we have many students with chronic conditions. We have students with diabetes. We have many students with mental health problems that for example, our medical staff or our nurses may not be well educated to address, for example, the mental health circumstances of the students. So in this case, we try, first of all, to have an integrated approach in our primary care unit. And of course, we try to offer training, interdisciplinary training and interdisciplinary care pathways. And this was another problem that we faced initially, because we have shared records for many professionals, while at the same time we try to protect personal information and sensitive information. So all these have been used accordingly, both to increase the skills of our staff, but with a way that is helpful for our students and meets their special needs. And also we try to offer a certain pathway for our students which accommodates their needs, and without delaying them and without offering more barriers when they are visiting our services. We don't have separated pathways for each professional, but we have tried with a lot of efforts and very carefully to integrate all these professionals into one system and collect there all the relevant information which is useful to be able to offer effective and qualitative care for them.
Last question, Maria, before we move quickly to Christian. Any special attention to students with a migrant background?
Quick answer. Quick answer. Okay. The special attention is that we have set all these new units. For example, migrant students are not confronted as a special group of people, first of all. So we try to accommodate their needs by showing a sensitive approach. If they are facing a special situation, of course, they have our counseling services. If we have also from the LGBTQI community, we try to raise this. Also raise visibility for this community as well. And we have certain units for this, for discrimination based on our recent law. And I don't have to say anything. We don't have something special for migrants, but we try to integrate them through our peer support system and make them part of the academic life the soonest possible in our university. I don't know if there is something in mind for who asked this question, if there is some special requirements that those people thought about. If you mean language difficulties, cultural difficulties, all this, we try to address them by integrating migrants smoothly with peer support system, with newcomers mechanism that we try to fill them as part of the academic life very early and as soon as possible. That's what we try to do.
Okay, thanks. I see here I have a problem.
And Christian is with us.
Yeah, Christian. Maria,
Christian?
thanks a lot. This is helpful, but I think we need to go quickly to the next one. And it's Christian Wascht from the University of Graz, a medical university, very prominent member of the EFPC. So I'm happy to have you here about the program on psychosocial crisis and health promotion for medical students. So really a similar subject. I try to be quick with sharing my screen for this presentation because I wasn't able to give it to provide you the floor with the presentation yourself, Christian. I hope it's shared now. Yes, I think so.
Yes,
so shall I go quickly already to the next slide?
Yeah, sure you can.
Okay.
Okay, so hello, very warm welcome also from my side. My name is Christian. I'm from a background specialist in psychiatry and psychotherapeutic medicine and psychotherapist. So about 11 years ago, we started to build a kind of program which was focusing on the topic health of students, especially the point mental health of students. So that was a very small program where we focused mainly on the topic crisis and crisis intervention for students. And from year to year, it started to grow more and more. And now we're on a very full program of different kinds of topics, what I'm glad about to present to you today. So one of our main questions is, how can you talk to your patients about health if you're not committed to your own health? So how is it possible as a physician, for example, here in Graz, to talk about lifestyle prevention, about health promotion, about different kinds of stuff if you're not also focused on your own one? Next slide, please. So if you look on the papers and on the research, there are much information about it. So for especially addition to the burdens during the study time, the probability of being ill in later professional life is increases, as we know. We know that learned stress management is a very important and very good marker for the future life, for the future happiness in the job, but also from the point of view how good you can care with your patients and can deliver care to your patients. What are reasons for rejecting support as a doctor, for example? That you maybe have career-related disadvantages or concerns about the stigmatization, for example. And we also know that resolved and unresolved stresses can affect the patient's care in the long term. Yeah, so it's not only about us as physicians, it's also about our patient and how good is the care that we can deliver to our patients. We know there's a significant correlation about depression, for example, and doctors and prescribing errors in everyday work. And we know that when we are not looking good at our own health, we're not good in motivating our patients to change their lifestyles if they have problems, especially with drinking alcohol, for nicotine abuse, and so on and so on. Please, next slide. That's only the background information. If someone is interested in it, I can also send it to you. Maybe the next slide. And we know, especially in the last 10, 20, 30 years, that this is a much more important topic. And since 2017, there's also the Declaration of Geneva from the World Medical Association. And there is one bullet point: I will attend to my own health, well-being, and abilities in order to provide care of the highest standard. So it's not possible to say we have the highest standard without our own health. So from this point of view, 11 years ago, we started with the peer-to-peer program, and the peer-to-peer program is the kind of a program where students who are specially trained are giving care to their fellow students. And how that works, I will show you on the next slides. So we have 4 main topics. Topic 1 is psychosocial crisis intervention. So if the burden is very high, the situation is very acute, there is a high burden of psychosocial problems, then you can come to us, then you can contact us. The second point is psychosocial stress management. So in case of sleep problems, for example, or nervosity or anxiety and so on, you can contact us and we can look together with our student tutors, maybe what are interventions that we can set and that can help in this kind of situation. That's all about acute intervention and maybe a little bit prevention. But with 2014 and 2015, after I started to work as a manager in this program, we also took a strong focus on health promotion. So on the one hand, junior mentoring, for example, so that we already go on the first day in the first week of the student's life with the fresh years, and we're talking about mental health in the study time period. We are talking about problems and possibilities in study, but also in private life, and try to make some kind of positive perspective about this kind of topics, but also that they know that we are here if there are any kind of problems. The last point, that's the educational part. That's the knowledge transfer, health promotion and prevention, about over lectures, for example, or workshops and so on. And the whole program is anonymous, it's free of charge, and we hope that it's a low threshold service. Maybe one slide back, Derek, if it's okay. Perfect, thank you so much. And how do we do that with this kind, how do we manage these topics? With free organizational components. So the one first is a free elective open to all students on the university. So we have about 4,000 students on our own university. 3,000 up to 3,200 are medical students, so future medical doctors. About 100 to 200 are dentistry students, and 300 up to 400 are from nursing sciences and doctoral programs. So we have this open elective for all students. The second point is our support. Our support is done by our student tutors, at about 14 student tutors at the moment in our program, and our practical and theoretical training, as I mentioned before, lectures and workshops. Thank you. Next slide, please. Thank you so much. So here is a slide about this elective. This elective has a focus on students' health, not only mental health, but students' health. It has a focus about learning techniques, concept of psychosocial crises, relaxation and resources, about crisis from a psychotherapeutic point of view, and crisis from a psychiatric perspective on view. So for example, how you can deal with suicidal intentions, how you can handle with suicide, and also it's some kind of pre-program for our future tutors. So every tutor who is working in our program has to do this elective, and after finishing it, that's possible to work at our program. The program is held by 4 people at the moment, so one of them are me. Then we have also one psychotherapist, one psychologist, and another colleague of mine who is a specialist in psychiatry. The duration is 1 semester, and it's about 8 units, and every unit has about 3 hours of time. So what's the point for November 2022? We have this consultation service. This consultation service means that students of our university can contact us per Facebook, Instagram, or per email, and can tell us about their situation at the moment, about their problems and their needs. And then we make an appointment with the student and look on an individual perspective what we can do. And if it's necessary, for example, to do a referral because there is some kind of depression also a topic, or anxiety disorder, for example, we have a background team of psychotherapists and psychiatrists where we can refer to. What we are doing about our knowledge transfer, so we have a kind of organization of workshops like music relaxation in general, but also learning techniques. Why that? Because we learned in the last couple of years that it's very hard to go to medical students and say, oh, maybe please come if you have a problem, because there must be a high level of burden that they came to us. So we try to take a focus on their daily life at the university, for example, the learning techniques or the problems in different aspects of the university, to reach them and to give them an impression of what we are doing and where we can support them. Also from a kind of view that we want to try to make some kind of mental frame changing, so that they know, no, it's not the point that you have to come if there is no other possibility anymore, but that you come if you think, okay, I have to manage something, maybe change something so that my future life is a little bit easier than it's at the moment now. We have different kind of lectures. The most of them have something to do with soft skills, for example, but also about general topics, health of students, medical students, or for example, how to sleep well, what's about nutritional aspects, for example. And then we also have some kind of social media initiatives about some kind of standard mental health topics. What we do as an additional offer is, for example, group mentoring for fresh years. So every fresh year student has the possibility to come to one of our group mentorings, where we focus on the topic mental health, starting at the university. And there are always two of our tutors who are telling how was it for them when they started, yeah? What was their problems? What did change after the years? And if it's that bad also after 2 years, or did they also involve in a different kind of view, where they say, okay, for 2 years it was like this, now it's that, and it's not that hard as you think maybe in that moment. And we have since 2 years also a podcast about nutritional aspects of mental health, for example, and we have some kind of digital offers on our university intern digital campus. Next slide, please. So if you want to have some information or further information about our program aspects, please use our resources. For example, it's our website on the Medical University of Graz, but also our Facebook account, or the most of the stuff is at the moment at the Instagram account. Next one, please. There is only a short slide about our efforts to have a kind of good quality management of our program. So on the one hand, it's the aspects with the focus on the team. So we have a concept meeting every semester, for example. We have regular team meetings every 3 up to 4 weeks. And we have some kind of team building like Christmas party or some events and so on, so that the cohesion in the team is working well. Then we have a working process. That's the process that's on the one hand our standardized documentation, with a group supervision every 4 weeks with minimum 3 team members, and every team member of the program have to do 2 supervisions per semester. There's also the possibility to have a single supervision if needed, not only about topics about the program, but also for private and daily issues of our tutors. And with theoretical and practical training during the semesters with experts like to communication, for example, or how to handle the death of a patient, for example, and stress management or sleep quality. There's always this kind of advisory board of medical psychotherapeutic experts in the background who are there for the students if they have some kind of further questions. Okay, we can go think to the next one, so that you only see how it's working. So we have about, at the moment, 40 up to 50 contacts on the peer support system each semester. So for example, one student is contacting us over email, then there is a first contact. After the first contact, there is the decision, okay, is it a problem or is it a topic where it is good to go on further? So if it's that, the colleague of the tutors are starting with the documentation, and if necessary, he can make a supervision with me, ultimately after the contact, or with our psychotherapist who is on the background. If there's a follow-up, there's the next documentation, and then you have in this kind of circle every 3 up to 4 weeks the team and group supervision. If there is any necessary that you also need an expert because of kind of too high burden, for example, depression, anxiety, and so on, we always trying to arrange a first meeting with expert psychotherapist or psychiatrist in between of 24 hours after first contact. Next slide, please. So overall, we have about 300 up to 400 contacts per semester. 40 up to 50 are directly from the peer support. The rest is from workshops, lectures, group mentoring, and additional events over the whole semester. When you take a look on these 3 columns, we have on the left side, that is the peer caring, so the peer-to-peer program. That is all that I showed you in the last couple of minutes. Then we have also our column about teaching. So there is compulsory teaching. On the one hand, this one elective that I told you at the beginning of my presentation, but there's also a medical humanities elective where we are using approaches from the humanities to discuss medical topics like death, patient, control in the medicine, power in medicine, and so on. And what was possible to do since 2018, there was the possibility to put some of these topics also in the core curriculum of the medical students program and at the medical university. That's especially self-management in the medical profession and relaxation techniques and supervision. So every student on our university has to do this, and there's a exam about this topic, and so they hear it only or minimum 1 time in their study life. And on the right column, you see also our research projects. So we have local research projects, for example, educational research on our electives. And on the other hand, we have now a focus every year on gratitude, resilience, personality, and mental health medical students. That's Graz local. And we have some multi-center cross-sectional studies with Germany and Hungary, and also a knowledge transfer with different kind of partners in Germany. Next slide, please. So I'm coming to the last 2 slides or 3 slides. So that's only one slide that I want to show you, because it was for us very important, because 2017 up to 2019, we founded an international network with Germany and Graz about the topic health of medical students. There we did one review about what keeps medical students healthy and well, and we screened about 5,000 abstracts and 5,000 publications. And on the bottom point, we only found 6 papers where they described health promotion points, where they look on the positive and stringent aspect of medical students' health, and not about burden, depression, anxiety, and so on. And that was for us one important point to say, okay, we have to look at these points, not only on that what we are doing, but also on our research projects. Next slide, please. So that's the last slide. So what are the take-home message from my side from this presentation? So the one point is students' health is an important topic and a responsibility. It won't go away, even if we want, or if we will, but it won't. Second point is we are interested in cooperations. If anyone is interested in have an exchange with us, and at the moment we are creating a network of medical students' health, especially for the German-speaking area. So, but if you want to join it, or if you want to have a contact here, please join us and give me a short message if you're interested, and we are happy about that. Last slide. Thank you so much. And there you see a picture about the students and student tutors of the team. They are the heart and the soul of the program, and they are doing the most of it.
Thank you, Christian. Interesting, and thanks for the invitation, of course. That's well accepted in the sense that we see here 2 members of the European Forum for Primary Care being interested in this subject, and I think it's very much primary care related. So I think there is a reason for cooperation, and I think Maria certainly would like to jump on that based on this presentations.
Yes,
and
I have already expressed my interest in Christian's work. It's very impressive, very good. Yeah.
I have a quick question to you, both of you, before we are ending, because we are a bit late. But Maria did a survey about the problem. My interest would be, is it getting worse according to your experience and according to what you see as a burden and what you need to do to assist these students in being in difficulties, in mental difficulties? Is there a worsening, or what's your impression?
I think there are two aspects. The first aspect, if there's a high acceptance about the topic, so there's a new or a different point of view of the students about the topic. So what we see is that they are much more interested to use the program also at earlier points, on the one hand. The second point is that, especially through COVID pandemic in the last couple of years, there's a much higher necessity to use the program. So what we have in the last couple of 1 or 2 years, the point is that we have much more questions and much more interest about the topics like having a depression, having anxiety, for example. Yeah, that's much more evident than for 2 or 3 years, 4 years before the pandemic. And that we see because at the moment, for example, I have 4 students which I'm caring in psychotherapy. My second colleague here on the department also have 4 up to 5. So it's only we both have 9, and that's about doubling twice as much as 3 years ago, for example. And we also see it because the support system, for example, 4 years ago, we had about 7 up to 10 students to 20 contacts. And after pandemic, it's about 4 times higher.
Yeah.
The rest is the prevention part. And that's very important because before that, there was no idea of lectures, for example, lectures about how you can be or how you can stay healthy. Mm-hmm. The old system was about, hey, you're healthy or you're not. And focusing on the issue, it's about staying healthy, and it's okay to be staying healthy. And there is a point that if we are sick or if we are not healthy, that's not only a problem of our point of view, it's also a problem about our patients, for our patients.
Yeah, thanks. And Maria, what's your impression?
My impression is that we still have a lot way to go. We also have, although there are many advancements in the last years, I think vulnerability is on a raise because of COVID situation, and we still haven't seen nothing. I think we haven't seen anything. Even now, we start to see families confronted with unemployment, and mental health conditions are on the rise. And I think the next years will be very difficult, and we will see them these problems coming into the university setting. And this is why we need to be proactive and alert to address them appropriately.
Okay.
Yes,
yeah.
and all, yeah, that's
before ending and before Dineke and Ian and maybe Lisa are leaving, back to the cooperation thing, is this something what the mental health working group of the EFPC would like to foster and to maybe to take into their working group, or would it be something separated?
But the most beautiful, I think it's the bridge between the mental health working group and education in primary care. And that's the connection. And we need more connection between the working groups. So I don't think it's just one of the parts. It's a beautiful extra as a bridge between both.
Okay. Ian, do you have an opinion about that? Or is it Lisa?
Yeah. It's both of us, yeah. We're basically agreeing with Dineke. Thank you very much. You said it very well.
Yeah.
So,
okay.
And it'd be interesting to share the research. I think that we've put and the research you've got together to sort of like bring what's happening now as well in different countries and different areas. Because I completely agree with you about this. I think we're seeing in undergraduate, we're seeing a huge rise in mental health coming through, and the impact on that on graduate over the next 2 to 5 years is going to be absolutely huge. So I think your research is incredibly relevant, and potentially there's something that can be done. And the other universities I do know are doing some work, so it'd be interesting to see how this would all link up with other universities and colleges where they get recruited the undergraduates from, where I know they do a lot of wellbeing work as well. So yeah, really interesting, really enjoyed it today.
Yeah, thank you very much.
Okay, so how to move forward. I think there was a request to share the presentations. We have recorded this, so that will be available also on the YouTube, our primary care EFPC YouTube channel. But we can share also with the participants, I think, the presentations. And then I would suggest that those who are interested to join such an initiative will send us a message, and we will make sure that it will end up with Christian, Maria, and the mental health working group, and to see how we can develop this further. Having said that, I think we have to stop because it's 10 minutes late. Thank you very much, all of you, for attending. You saw in the middle of the webinar our announcement for the Istanbul conference next year. It would be nice to have a session on students' mental health in this conference next year. So this invitation is yours. Hope to see you all there, and maybe in the meantime in other webinars like the 30th of November. You comes together with EFPC. Dineke will be there as well, Ian, Lisa. So please join us. Have a good day and see you soon. Bye-bye.
Thank you.